Welcome to another episode of the band Badass Moms with Lori and Jenny. And today we are so excited to share Heidi with you. She has such an amazing journey, and I'm going to let her tell us all about it. But at first, I want to let Jenny kind of introduce how she knows Heidi, and we'll go from there.
Yes, thank you, Lori. So, Heidi, thank you for being here. I met Heidi. I worked at Children's Hospital, Colorado, a few years ago, and I was Heidi's HR partner, and was completely just fascinated by the work that she was doing, and so impressed by the work that she was doing for kids. And I remember at the time, Heidi, I would ask you all kinds of questions like, what do you know about social media and kids? What do you know about phones and kids? And I would come home and tell my kids and tell my husband. And so I followed your journey pretty closely. And I'm just so incredibly impressed with what you've done. And you have taken this leap into really focusing on mental health for kids. And so when I saw that, I reached out to Heidi and was like, please, please, please come join us on the show. And she so graciously accepted.
Oh, well, thanks for being
I
here,
couldn't be
Heidi.
more thrilled. Yeah, thank you. What an incredible opportunity. Thanks.
So let's start off by, why don't you, in a nutshell, because that and then we can kind of break it down from there. What you're currently doing, how you got there, and yeah, we'll just kick it off and start from there.
Sure. I'm president and CEO of Speak Our Minds, a national nonprofit really focused on ending our current youth mental health crisis. And this organization was born out of children's hospitals from across the country, spending 18 months sort of at the height of COVID, really sounding the alarm on the youth mental health crisis. We had a lot of attention, obviously, and understandably, on the COVID pandemic. And what children's hospitals wanted to talk about as well was what they were seeing by way of what was happening with youth mental health. We were seeing a lot more kids in much higher levels of need and in crisis, and it was overwhelming pediatric systems of care. And so as a result of this education and awareness campaign called Sound the Alarm, you can only sound the alarm for so long, right? And then things need to really move from alarm into action. And so that's when children's hospitals said, we need something that's going to move us into this next action phase. And then that's where I was given the opportunity to come in and create Speak Our Minds and really focus on the action component, which is, how do we build a working system of youth mental health care in this country? Because we don't have one. And that is our entire focus at this point, is making sure that all kids in a very inclusive manner have access to high quality, responsive, and reliable care.
That's awesome. So speaking of mental health, let's back up even further. How did you kind of get into, so you have a background, you were an attorney for many years. And how did you kind of find yourself drawn to mental health and specifically children?
Yeah, thanks for asking. It's a great question. And I think, like lots of us, I haven't had sort of this linear path into this world. And a lot of people who work in mental health do so out of a passion of lived experience. And while I did grow up in an alcoholic home, and that did have an impact on me, that isn't what led me actually to really want to devote my whole career to youth mental health. It happened as a young attorney in a very surprising way. I wound up representing kids at Colorado's Protection and Advocacy Agency for Kids with Disabilities. And in that experience, one day I got a call from a mom, and I always try not to cry when I tell this story. Maybe this will be the first time I can do it without crying. But I was only in my 20s at the time, and I didn't have the experience of being a mother yet myself. But she called me sobbing because her son had been in a public school, struggling with some mental health issues, and the school, for a lot of different reasons, mostly a lack of awareness and training, had locked him in a closet. And this was, not that long ago. And they had left him there to the point he was wetting his pants and really engaging in a lot of very self-harmful behaviors in an effort to try to get people's attention to be let out. And no parent And no child should ever have to go through that experience with a child in this country today. And it was what led me to get involved with families who had kids with mental health issues, whose kids were being tased in school settings by student resource officers who didn't know how to respond, who were being physically restrained. And these are kids with a background with trauma, and it was exacerbating their trauma response and making things worse. And thinking to myself, oh, we all deserve better.
Mm-hmm.
Educators deserve to have the resources they need to be able to respond in complicated situations.
Mm-hmm.
These kids deserve better, and so do these parents. And so that's really what opened the door for me to say, for the rest of my life, I care deeply about this topic. And it has had some element of a presence that has informed why I care so much about this topic of mental health. And then I would say, just most recently, having been at the hospital and seeing sort of moving this crisis now forward,
Mm-hmm.
all of these kids who had nowhere to go, who had been struggling, a lot of them in silence, but had been struggling for a long time, to the point where it finally gets on parents' radar. And sometimes that takes a while.
Mm-hmm.
And parents not knowing what to do, right? If your kid comes home on a Friday afternoon at 5 o'clock with a fever, you know where to go, you know what to do, the doors are open, there's a system there to respond. If it is anything in the space of mental health, parents go,
Yeah.
I don't know. And so they're all headed to a hospital emergency room. And while hospital emergency rooms are fabulous places for a lot of things, they're not fabulous in the creation of a therapeutic environment for a mental health condition. And watching kids wind up in these hospitals and in an emergency room, which you can picture in your mind what that looks like. It's stark, it's windowless, it is, like when we all have to go there and get stuck there, you don't want to be there for very long, right? You want to get in, have your need met, and then let's move this along, right? And kids were winding up literally living in these hospital emergency rooms, sometimes for months, if you can imagine.
Wow.
Because there wasn't care for them. There wasn't a system, there weren't enough services to be able to meet their needs. And so parents are like,
what do we do?
How am I supposed to help my kids? These kids are like, I want out of here.
Mm-hmm.
This is not helping. And it was making them worse. And then you have a already taxed workforce saying, we need help. We can't keep doing this. And as these kids are getting worse, some of them are physically aggressive.
Mm-hmm.
And staff get hurt.
Right.
And it burns them out. So it was all these things that it was like, we have a lot of work to do here, and we need to do it now. And we weren't getting partnership when we were reaching out and asking for help from very important partners in state and federal government. So it was all these things
that just
have really informed.
Collided.
Yeah.
Well, and you were at Children's, was it 11 years?
13.
13. Oh my gosh, 13 years. So you were there for 13 years. So did you witness this? Like, how did it come to your attention initially?
Yeah. I did witness this because of my relationship in the government affairs space and having the opportunity to advance policy on behalf of the hospital. I was contacted by our emergency department and mental health teams to say, we've got this problem. Mm-hmm. We need your help. And so we ended up being on, and I'm not exaggerating, daily phone calls with lots of different partners trying to get these kids services. And most of the time, very well-intended people would shrug their shoulders and just say,
there's just nowhere to go, right?
Yeah.
I mean, there's just nowhere for them to go, I think, right? Like,
yeah. And I do want to get into the documentary, because there's an amazing documentary that Lori and I had the privilege to preview. And a couple of things that struck me were the rooms themselves, to me, looked like solitary confinement, which, if you've heard anything about like prison and solitary confinement, it is one of the most horrible things that you can experience, right? Just being separated from everybody. And then the other thing was that all these people that care so deeply about children have no idea what to do. And you said something really poignant about the meetings, right? The meetings were, let's have more meetings and invite more people. And I think that we see that so many places, but nothing gets done.
No action, right? I mean, I think, Heidi, based on what you've said, is the problem has been there. And it's obviously, I'm sure with COVID gotten so much worse, right? And the fact that people
Yeah.
know about it, it's there, but the action, and that's what you're clearly working on, is making things happen and making a change happen. Um, I think, like Jenny was saying in the documentary, one of the things that I think is very clear too is the desperation of the parents.
Oh,
They just they don't know what to do. They know they need to do something, but same thing, they're not not that they're not educated, but they just don't even have the resources to guide them in the right direction.
Yeah, that's right.
is that what initially, I mean, you were at Children's for a long time. You did very well there. You had amazing relationships there. So is that what made you like, were you finally like, I have to do this full time?
Yeah. No, I had the most amazing. I mean, I always said when I was there, I have the best job at Children's Hospital, and I believed very much and still believe that that was the case. I wouldn't have traded my role with anyone, and I was very happy there. And I got to work with, as you know, Jenny, world-class talent.
Yeah.
There were these physicians and nurses and other providers, right, who are saving kids' lives by day, and by night they're helping me with like policies. Like, come on, the most amazing situation. And so leaving, that was not a small thing to contemplate, but I did get to the point where I was very clear, much to the chagrin of my husband, that all I wanted to do was work on youth mental health, and that I knew very well what needed to happen, and that I wasn't completely sure on how all this was going to come together, but I was going to be part of the solution, and not just for a few kids, but for all of our kids. And so that's really what led me to leave and work on this documentary, and then join forces with others to create Speak Our Minds, because it was time. It was like, I can't and also I couldn't sit in another one of these meetings and
Yeah.
just have people on the other side of the screen stare at me and shrug their shoulders and say, maybe if you send more data, or if we just had a few more things in place, we'd be able to be helpful. And have that be the response to productive solutions that were being put in front of them, and having people just look at you sort of deer in headlights and be like, that doesn't seem feasible. It's like, what are you talking about? Like, how are we living in this time of inaction amidst great suffering?
Yeah.
So tell us more about Speak Our Minds. That's the company that you created. Tell us, where your ultimate goal is. Obviously, we kind of understand what it is, but a little bit more
Yeah.
specific, and how you're growing that, and how you're getting change to actually happen.
Yeah, so Speak Our Minds, with a whole focus on building a system of youth mental health. Let me just start by saying there are so many amazing organizations working on mental health. So the good news and the fancy problem is there are a lot of people, luckily, working in this space. What we felt like was missing from the current equation was this overarching concept of, okay, if we do things like reduce stigma and get people to start reaching out for care, and we start having more teachers, for example, aware of mental health conditions and being able to refer kids into services, there is not a system to support them. So all these amazing other efforts are going to fall flat on their face absent the system to serve these kids and their families, right? Because parents are part of that equation. Kids don't come without a family. And so, what we're really focused on is, how do we engage in both education, awareness, and storytelling, and action to be able to build this system? And so, Speak Our Minds is really focused on very much on the education awareness piece. So, letting people know all of the different parts of a system that are required that aren't working, to then get people to partner with us to let our policymakers know, here are solutions, and here are some of the things we need to be doing differently today. And one of those is around the Medicaid program, which serves over half of the kids in this country. And how do we make sure that it is working to the very best that it can? It's funded by taxpayer dollars. It is meant to be a robust program. How do we make sure that it is as effective as it can be in meeting kids' needs for mental health? So that is a very big effort for us right now.
Yeah. Well, and so what made you start a nonprofit film company? So Speak Our Minds is one piece of it, but then you also
Yeah.
started this nonprofit film company, which, by the way, I told Lori the logo and the name of it I love so much. Will you tell us about that, where that came from, and tell us about the film?
Sure. So Rebel with a Cause Films is the nonprofit film company. And this probably was what gave my husband the greatest amount of heartburn when I said, not only am I quitting my job, but I'm starting a nonprofit film company. He's like, you don't know shit about making movies. What? You're doing what? And it was like, yeah, well, here we go. We're going to see how this works. Yeah. So, the name really comes from not being shy about tackling difficult subjects and with a very clear purpose to engage others in talking about these issues and in driving change. So that's where the Rebel with a Cause name comes from. And the concept of a nonprofit film company, it was very clear to me that I wanted to create content that felt community owned, community responsive, community driven. And so to be able to say, I want lots of different people to feel like they can come together and fund projects that are responding to needs that they're also helping to identify. So that was another reason why I went the nonprofit route. And the intention was never, how do I make money off of these stories? It is, how are we using these stories to drive change? And so that's how that initially came about. And then obviously my personal experience at the hospital and watching profound suffering amongst families and patients and providers being met with just complete inaction is what informed this first film, The Wake to Nowhere.
Yeah. And tell us, were scenes that were filmed at Children's Hospital Colorado and also in other areas. I recognize Cincinnati. I actually had to take my daughter there one time when she was little. So there's these amazing hospitals all throughout the country that partnered with you on this. Tell us about that.
Yeah, so this issue of kids getting stuck in hospital emergency rooms is not limited to Colorado. It is a national crisis. And so we were very fortunate to have many children's hospitals, Connecticut, Texas, Louisiana, many come together and be very brave. Because as you know, Jenny, children's hospitals are used to being the places of healing and where solutions happen. They are very much used to being the good guys. Having to say, this isn't working, this isn't going well, we aren't able to be the place where things are going well and where the healing is happening in the way that we're used to, is not a comfortable thing for children's hospitals to talk about, let alone allow on camera. So there's a lot of bravery that may sound silly to some, but really for these places to come forward and say, okay, well, the only way we can see ourselves having this be different and finding a solution is to allow you to show how bad this is and how bad it is within our spaces. And that is not a comfortable thing to be able to do, but it will be the thing that helps drive change. Because you can talk about these issues, right, to people and they go, that's horrible. But then when you see it, like you said, Jenny, with the room, it is like, what in the hell?
Yeah.
How is that happening in 2024 in the United States? How is this happening?
What I thought was, obviously, that was even more impactful is I had no idea there was that. I think you threw the number. I don't know if that was just for Children's Hospital Colorado, where it was like 30 to 60 or whatever children a day going to the emergency room. And absolutely, I would have never, I thought, oh, before you said that number, I'm like, oh, maybe there's like 5 or 10. And then I was just blown away.
Yeah, I
Mhm.
had no I mean, I did not know, I'm embarrassed to say, but this again, like, if we share, then we change things, so I'm
Right.
embarrassed to say I had no idea this was a problem, and I'm
Yeah.
guessing there are a lot of people that are in that same boat, and
Mhm.
watching that, I mean, you weren't when the woman reached out to you when you were in your 20s, you don't have to be a parent for this to deeply resonate with you.
Yeah.
Absolutely not. So with that, Heidi, let's kind of take a step away. You are a mom, and you are clearly a very badass mom. You have 2 boys,
We do.
9 and 11, and let's talk about how you've been doing so much, very, very busy in the corporate world, and then now very, very busy in the entrepreneurial world, and helping all these other children. How have you been able to juggle it all and raise your boys, and just the fun of being a mom, right?
Yeah. Well, I think the honest answer is, I don't think there is ever a moment where I feel like work-life balance is ever being achieved. It's sort of where the deal's getting struck,
Yeah.
at the moment, and to what degree am I, compromising in the appropriate places. I would say to you, as I made the change in leaving the hospital environment and now doing the work that I'm doing, I feel closer to achieving a balance,
Mhm.
because it is a smaller team with a very clear focus and really driven much more on my terms, which means, I get to be home with a sick kid and not, stress about the 20 meetings I'm missing, and all of the deliverables. It feels much more like, okay, I can handle these things. But I also think I didn't realize how much I had allowed in previous roles my work life to distract and intentionally serve as a distraction from other issues happening in my personal life. And when you pull out of that setting and
Mhm.
you sort of are present with everything happening around you, um, I got very clear that that's where my focus needed to really remain. And how was I going to run uh, an organization committed to youth mental health if my focus wasn't on ensuring for my own kids' well-being first and foremost? Like the contradiction wouldn't stand.
Yeah.
And so I think that is the biggest piece of this equation, at this point. And I would say too, as a mom, when I think about my moments of greatest concern and, uh, where I want the most help, it's around those emotional and mental
Mhm.
well-being components for my kids, and it also feels, as a mom, where the biggest gaps are. And as you know, I'm very well connected. I can pick up the phone and call about any number, of different world-class mental health experts, and even then, I'm like, "My God,
Yeah.
what am I supposed to do here?" And if I don't handle this well, just given what we know and what we see, am I putting my kids on a path that they won't come back from in a positive way? I mean, those are questions we ask ourselves
Yeah.
now, and it is, it's hard.
I've
I think
said
it's really hard.
many times that when the kids are little, you're all about it's trying to keep them like physically safe, right? Making sure they don't fall, bump their head, keeping them away from hot things, whatever. As they get older, and I have a, 21 and 18-year-old, and you think it's going to be easier, but it's actually so much harder because of course you still worry about their safety, but you worry so much about their mental health and their emotional health and their emotional safety, and the stakes are so high, to your point. Like, what if something happens that is beyond the point of no return, and we're just not equipped to handle those kinds of things, and we're doing the best we can, but we're not equipped to handle them.
Yeah,
Yeah, I mean, as moms, we worry about everything, right? And I think we had a
yeah,
guest, I think, said it the best one time is your heart is you have another heart on the outside of your body that you're always, concerned about, thinking about. And although they get older, those concerns and those worries change. And so that's kind of a question with your boys. So I have a stepson that's almost 16. So when we talk about mental health and wellness, that's a very interesting age, high school, middle school, and your sons are obviously starting to get a little older and starting to kind of approach those big transitions in life. Are you doing anything specific to prepare yourself or prepare them, knowing what you know? Or I'm just curious.
And how has it changed? Like,
Yeah,
it's so different.
yeah,
Yeah. Well, one thing that I would say, um, how we recognize things when they're young matters a great deal, and how they're addressed and supported for healthier approaches to what is inherently higher risk activity that happens as our kids age. And so I think what has changed as a result of my own professional development has been this awareness that what I notice now, the challenges that we have now, you do not wait. You
Yeah.
do not wait to see how they go. And the sense of, is this that serious? Is this like, should I, maybe this is just a phase. Maybe
what's
I should just
normal
sort
and
of,
what's not, Heidi? I think
yeah,
that's the biggest thing that, we've encountered is having a
yeah,
teenager is he just a grumpy teen, or is there something more going on? And I know Jenny's been there too, but it's like, it's hard. It's an education piece. Like, is it okay? Is this typical behavior, or should I be concerned? Like, so I think that's a very difficult call sometimes.
yeah. And what I would say is the extent to which we teach people, oh, to like move away from their instincts is our
Mhm.
biggest problem.
Hmm.
Like, there's a reason parents ask that question. Is this normal? Well, the answer is clearly not, because it wouldn't be on your radar if it wasn't, right?
Mm.
Like, I don't know, is your kid acting like that 2 days ago, 2 weeks ago, 2 months ago? No. Well, then something changed.
Yeah.
And it's important that we understand what it is that informed that change. Could it be hormones? Sure, it could be hormones, but then that means your child is going through, sort of a moment of physical development, right? That needs to be talked about, that so that they can understand what's going on with them, that there may be a hormonal component that's informing their behaviors, and let's like just talk about that and make
Mhm.
that normal.
Yeah.
But we don't allow ourselves that sort of trust in our own instincts to say, well, something's up, and maybe I'm not equipped to deal with this, and so I'm gonna have to reach out, and I kind of feel silly, but I'm gonna call somebody. I'm
Yeah.
gonna call a pediatrician. I'm gonna call a mental health provider, and I'm gonna say, this seems to be going on. What do you recommend? Or what's the kind of conversation I should be having with my kid to better understand what they're dealing with? And that should start young. I
Yeah.
will tell you, one of the most shocking moments in the last few years for me personally, within the context of the hospital, was losing a 7-year-old
Oh
to
God.
suicide. Like, we say these things, I'm older now, but like when I was a kid, I did not know what that word meant
No.
until much later in life. I did not know what that word meant, let alone contemplating
Or how
and
did
or acting on those kinds of thoughts. So to be in a state of the world now where a 7-year-old,
Mhm.
a baby, a 7-year-old
Yeah.
has those thoughts and acts on them, for me, demonstrates you do not ignore. You do not ignore.
Yeah.
You've given us all permission, and I think your message, that's gonna be a soundbite that we share over and over and over. And I think too, speaking to the younger, the better intervention, when your kids get older, at 18, you don't have access to their health records. You don't have access to, I can't go to a mental health, appointment with my daughter unless she says it's okay. And I had a situation where I was very concerned about my daughter. I reached out to her therapist to share my concern. She didn't even call me back. And I was just like, I don't know what to do here.
Because she's over 18.
She was over 18, she was a college student, and I understand privacy, and I want to make sure my kid is safe. And so what do you do about that, right? So
Yeah.
it's tricky.
Well, and this, so here in Colorado, kids starting at the age of 13
Oh my God.
can get care without parental consent, right? Because there's this recognition that we want our kids to get care. And
Mhm.
Jenny, not all parents are supportive of ensuring their
Yep.
kids get access like you are. And so it's sort of, you know your kid's struggling. There's some dynamics at home that they don't feel comfortable talking to their parents about. We want them to have access to a professional,
Yeah.
right, who can help them. And as a mom, so intellectually, as a advocate for mental health, I get that. As a mother, that is terrifying.
Yeah. Yeah.
Terrifying to think about, my kids at the age of 13 going and seeking care and never, I may not ever know.
Yeah.
And that is a new dynamic also as a community. We have to constantly think about, why would my kiddo need care and not feel comfortable talking to me?
Mhm.
And how do we have those conversations without getting upset at our kids and making that our kids' fault?
Right. Or
There's
shaming
a reason.
them or embarrassing them.
Mhm.
Yeah.
Do you
Yeah.
think in this particular situation, Jenny, it would have been like, did you reach out to your daughter to try to kind of communicate with her, or was it you were kind of
So I think that's an interesting point, and back to what Heidi said is, we ignore our instincts, and my concern of upsetting her and feeling like I was invading her privacy, I I felt strongly that I should talk to her about this. I felt like I need to get involved. And I kept saying, like, she's 18, like, she's trying to navigate things for herself. And I mean, honestly, I regret it. There's so many things. I mean, all the time I'm like, did I screw them up? Because there's so many things I'd like to go back and do differently.
every mom says that, Jenny, you know?
Yeah, no, I know. And somebody said to me one time, it's not over. Like, you can apologize for shit you did 10 years ago.
Mhm.
Like, I can
Yes.
tell my daughter, I am so sorry I was not there for you. Like, that time has not passed.
Right.
So, yeah, but it's tough. This parenting thing is tough. And I think that the work that you're doing is hopefully going to make it easier for parents, but hopefully for kiddos, right? And you did a film, which is insane. I love so much that you're like, I don't know how to do this. I'm going to figure it out. But what did you learn from it beyond like the mental health piece? What did you learn from it?
I will tell you the biggest thing that I have learned in this process, has been the extent to which following I feel corny saying this, but I'm gonna
No,
say it
say it.
anyway. Like, following my heart
Yeah.
has allowed for a whole new life to emerge, and as a result of just being like, I don't know how this is gonna work out, but I'm gonna keep moving ahead, and I'm gonna keep doing the research, and I'm gonna keep doing the things, and every single step along the way, I have had the perfect partners
Mhm.
present. And so when I think about, like, yes, the film is my idea and the story is my idea, but the production of this film, I did not do that.
Yeah.
Costello Productions did that. And Lizzie Costello and I worked together at Children's Hospital Colorado. She
Yeah.
started the video team at Children's. And so when I was like, I don't, and she left and started her own video, and film company. And so when I left, I was like, I'm just going to call Lizzie. And Lizzie took my phone call.
Yeah.
And then next thing I know, we're making a documentary. And so I would just say it's like, in the same way that we're talking about don't ignore your kids, don't ignore your instincts when it comes to, your parenting, I
Mhm.
almost feel like the same message applies professionally. It's like if you've got this sort of yearning, it's not there for nothing.
Yeah.
I
And the
love that.
extent to which we're able to follow and trust that, yeah, it's scary, and it's scary on multiple levels when you think too about, finances and supporting family needs
Mhm.
and all of that. But I just had this incredible experience, and I continue to have it, that the more and more that I'm willing to be in that space and just follow the direction, that pulls me,
Yeah.
it is always supported, and it's never in the ways I would think also. Like,
Yeah.
it doesn't. It never shows up in the way that I would think.
So Heidi, I have a question. Speaking of mental, health and wellness, what do you personally do to preserve your own sanity since you're tackling so many it's a lot of heavy shit. Like how do you step away and take your own breath
Mhm.
and say, I need to relax, I need to take a break. Like what is your sanity? What do you do?
Yeah. Well, I would say it's usually like an extended bout of diarrhea that is the indication that I haven't been taking care of myself. I was like, "Oh, well, let this go too
Yeah.
far." Um, just to be candid. So, I think the answer is, um, it de it's like it's different all the time. One, it's spending time outside. Like, I
Yeah.
just think in whatever way that can happen. I have dogs. We've all of course, I live in Colorado, of course
Yeah.
I have dogs. And so being outside with dogs, we are fortunate enough that we have, we affectionately refer to it as the farm. It's not a farm, it's a big patch of land, with a tiny, little shack on it. But being able to go there and
Mm,
just, not be on screens and to
mhm.
be present outside, I feel like there's nothing more healing and balancing and sort of, allows the recapturing and grounding of perspective than leaving, sort of the screens and the means, and just being away and disconnected, and trying to create even moments of that every single day, like
Yeah.
even on a dog walk, feels like the biggest thing that I can do to maintain my own sanity. And then also, like, in those moments of, like, inherently this work makes you feel like this is all very heavy and
Yeah.
serious, and there have to be ways to find lightheartedness and
Yeah.
humor, and thank God for my boys, right?
Yeah.
When you think about the nonsense, like, just the nonsense, thank God for it, because it's life-saving, right? Like,
Yeah.
I need goofy nonsense, and I rely on them probably way more than they know to give me perspective, like, "Okay, like,
Oh,
lighten up,
yeah.
yeah."
That's
Oh,
awesome.
they're so smart too. My husband and I, we were, like, agonizing over something the other day, and my 18-year-old daughter's like, "You guys are way overthinking this."
Yeah,
And,
and don't we? Yeah.
yeah, I'm like, "Holy shit, you're so right." Like, I don't know why we are wasting our energy on this, but yeah, they just bring in this I that's one thing I'm gonna miss so much. Thank God we have dogs because 'cause they're gonna both be gone next year, and I'm like, "Who's gonna keep us
Dogs are
productive?"
your therapy, like, I think
I
that's
know.
really what it is, they're just there to listen and to get you outside and to be your best friend and never talk back, and, I
Yeah,
mean,
yeah.
they truly are amazing.
I do
So
have one thing that I saw on LinkedIn that I have to bring up because you've had this very prominent voice, and you've not been afraid to speak it. You may have felt afraid to speak it, but you've been vocal and you've been an advocate for these kids and in the community. And one of the things I saw on your LinkedIn was the Maya Angelou quote. Do you want to tell that story?
Sure. So, in high school, I had this incredible English teacher, Mr. Larson, and like, clearly had an impact. I can still name him, talk about him, picture him,
Yeah.
think about his class. And at one point in the year, he assigned us to read "I Know Why the Caged Bird Sings" by Maya Angelou, which is an incredible book.
Mhm.
It is an incredible story, and there are some very difficult moments in
Yeah.
that story when she talks about being sexually abused and what that was like and how it informed so much of her adult life. And we, like we had with so many other books, we read excerpts of the book out loud in class.
Mhm.
And there was a parent after certain excerpts from that book were read that called in to complain about the book, about one reading it in class because of the subject matter, and then why were we reading this book to begin with, at this age, in this high school English class. And I remember thinking to myself, my God, like, what we're trying to do here is support kids and be able to expose real elements of the world so that it can live in the light. Like,
Mhm.
when we talk about these things, it allows them to come out of the darkness, to be supported,
Mhm.
and to have a parent's fear, and understandable, right? But fear and discomfort potentially keep this, um, in the dark, was like, I'm not going to do that. And so we were having more conversations, and of course a local news crew got called in, right? Like, this became sort of sensationalized. And I said, I want to talk about this. I want to be one of the students. So there was a small group of us, and I was one of them that got on camera, and I was petrified,
Yeah.
right? This is like you're like a sophomore in high school, standing in front of a camera, like,
Yes.
and it was a profound moment to say, I am scared. I am scared, and I am going to potentially look like a real idiot. And I don't care because it is important that we talk about this. And so it was a profound moment in that I figured out my voice meant something, and I felt very important to be able to use it as a way to provide support to
Mhm.
others. And thanks to a lot of different dynamics, but this small group of kids that was willing to be terrified and show up and say,
Yeah.
no, like we think this is important. And yes, it's an uncomfortable topic, but there's a reason why it has to happen. The book, and the reading lived on. But it was
Heidi, we're already taking action as a sophomore
I
in
know.
high school. Like,
She's
this
already
is
on
just
camera.
foreshadowing your whole entire life right here in this very moment of, like,
Yeah.
making change happen. I love that.
It also shows if you are passionate and feel strongly enough about something, you can push past your fear. And
Yeah.
I think that that is such an important lesson too, right? Like sometimes the message is so much greater than the fear that you feel that you just have to go for it.
Yeah.
That's
Yep.
awesome.
There's a kid's book. I'm remiss that I can't think of it, but it's like it's all about confronting fear, but it talks about it through the lens of a child story. And it is the sense of monsters can only chase you if you run from them.
Mm.
And the moment you stop running and you turn and face them, they go away.
I love that. Yeah.
And it's like we run without thinking about how often we have the ability to stop running.
Mhm.
And confront our own monsters and make them go away. And it's really a single act of standing still and turning that
Yeah.
changes that whole dynamic.
And most of
Makes
the time it's not as bad as you think it's gonna be.
Yeah.
Thank God, right?
Yeah.
Okay, so are more films coming? What are you
I
gonna
was
do
gonna
with
say,
your film company?
yeah, or when's the
Yeah.
current let's talk about the current one. When's the current one
Oh,
coming
yeah.
out, and how can
Yeah,
we
because
get
we've
that in
seen
Yeah.
it,
people's
but the rest
hands
of the
and
world
when?
hasn't.
Yeah.
Yeah. No, thank you for asking that question. So, we are Speak Our Minds is launching its own YouTube channel because we want as many people to be able to see this film. So the way to know where it can be accessed through www.speakourminds.org, and you will be able to find the film there, and watch it through that. We have had the opportunity to create another film. It's called Racing to Respond, and it is available through PBS. And if you just Google Racing to Respond, it will take you through PBS to be able to find it. That film really gets into the lack of a quality and safety system in youth mental health in ways that we don't think about. So like when you go in for a surgery, right, you literally have to write on the leg, for example, that you're going to get operated on. And then there's this whole, system that's in place to make sure you get the right operation at the right time with the right medication and all the right follow-up care, right? We don't have that in youth mental health. And so this film is one talking about the fact that we don't have that, and that there is an ability to create that. And if we do, that is yet another way we can begin to combat this mental health crisis. I want to know as a parent, for example, that when I reach out to a therapist to get care for my kiddo, that they are trained in the appropriate interventions to serve my child. There are over 65
Yes.
different mental health interventions that are evidence-based for kids, and most providers are trained in fewer than 5.
Wow.
And so it's like, if you think
Yeah.
about cancer, you go to a very specific kind of oncologist. I don't go to an oncologist that deals with brain cancer for my breast cancer issue,
Yeah.
right? And we want to have that same level of certainty for mental health. So Racing to Respond is this second film,
I have to ask
talking
quickly,
about that.
was Dan Hyman at all a part of that?
So he was not in the film, but he was definitely. Dan Hyman is a former chief quality officer at Children's Hospital Colorado, is the chief quality officer for Children's Hospital in Philadelphia, so one of the biggest in the country. And his getting to be inspired by him was definitely informant of the film content.
He was
Yes.
one of my favorite people at Children's. I just loved him. So,
Yes.
Heidi, how do people get involved with what you're doing? So people are going to hear this and they're going to be, wanting to reach out. How can they make that happen? How can they help get the voice out and just help make a difference?
Yep. We're going to continue to organize advocacy engagement opportunities through Speak Our Minds. So if people would be willing to visit the site, follow us on social, we're going to be continuing to create engagement opportunities there for people to say, this is what's going on with me, or I want to join this specific campaign with respect to youth mental health. So we would say, join us at Speak Our Minds. And also, I'm not cool enough to say things like slide into my DM, but slide into my DM and, talk about the issues that you're facing that you want to talk about. And, we're only as effective as people sharing where they have needs. The
Yeah.
whole point of building a working system of youth mental health is so that it works for the people with needs. And so for people to be able to share is another way to do that.
Any chance a podcast might be in the works for you?
Maybe at some point, maybe at
Very
some
good.
point. Yeah, that's nice of you. I'll leave it
That's
to the experts, Jenny and Lori, to handle
Well,
those.
thank you. Heidi, I mean, it's incredible what you're doing, and I know that bringing this to, just the front of mind of so many people that might not be aware of what's going on is so important. And I think it's amazing what you're doing, and kudos for you for taking action and being able to continue to just change the world for the
Yes.
better,
Thank you.
right? I mean,
Thank you.
Thank you
well,
for
thank
being an
you.
inspiration to me and
Yeah.
so many others. And yeah, I just can't wait to see where this goes. I already told you, whatever you need done, I'm here to help and support, and I'm sure our listeners are as well. So we'll be your army, boots on the ground, however you need support.
Thank you. Well, thank you both for allowing for the space to have this conversation. I appreciate it more than you know. So thank you.